We'll get going. I'm just going to give you a bit of an overview of where we are and some of our latest statistics, both starting as usual provincially and then breaking it down to our area. I'm going to share my screen right now, and we'll begin with the provincial numbers. Actually, the numbers have been in the 300 range provincially. Today they were up 306, and they've been kind of flattening the curves, as you can see. Again, the majority of the cases are non-vaccinated. I just wanted to point this graph out as of today. This is a provincial data that says for all ages, you can still see a much higher incidence of 7-day rates among the non-vaccinated versus the fully vaccinated, and that discrepancy gets even bigger when you're looking at 80 plus older individuals. It's actually a 65-75-fold increase in risk, and actually it's a pretty highly protective as well for 12 to 17-year-olds. In terms of our numbers here in Cornwall, we added 54 cases today. But I want to explain the 36 that we see in Prescott-Russell. Most of them were from one outbreak that we have in a home there. We're investigating it right now. I will talk a bit about that later, but that's why the numbers are up. You can see the SDNG had no cases. Cornwall had 18 cases. But again, you could see sensing that we're stabilizing our numbers. We're having right now we're almost the middle of October, so at this rate we'll have less than we had in September, which is good news. So we'll be keeping an eye on that. Like I said, our curve has been pushed upwards, mostly by one outbreak in a home. Actually, it's the yes, it is. It's a residence. It is down Saint François in Casselman, and we're working with the team there to get more information. We just got those positive results today, and I will be talking a bit about that later. Again, so we have 162 cases. We have hospitalized individuals, 6 in the ICU. We got our outbreaks again, some school outbreaks, and several outbreaks that we've had, most again around the Cornwall area. We had one death over the weekend. It was an 85-year-old individual with multiple medical conditions, unvaccinated, unfortunately, that succumbed over the weekend. Our 7-day rolling average here, really, you can see that we're flattening now. We've gone a downturn and going down a bit for Cornwall. This is the blue here. You can see our overall average had increased a couple of weeks ago, and then it's going down, and then it's a bit of a sharp increase here. That's due to what we have in Prescott-Russell at the home here in light orange. But again, overall, you could see sort of a downward trajectory if we were to remove those 38 cases that were added. Actually, it's 38. We're not sure. It's about 38, but we're not sure the final number. Maybe 33, because sometimes we get double named and so on. But again, just to give us an idea that overall, like I said, at least Cornwall is going down. This gives us a new graph that we've got our epi department put together, which kind of looks at the 7-day rolling averages, in terms of percentage of vaccinated versus non-vaccinated. And you could see that the majority of our cases over the 7-day rolling average were non-vaccinated individuals. The reason I showed that is because we're showing today that a higher percentage of our cases were vaccinated, were vaccinated, and that's because in the retirement home, those individuals were fully vaccinated, and it's not unexpected. We are seeing breakthrough infections in those individuals. Fortunately, most of them are not symptomatic, and that's one of the reasons that we're going to go and vaccinate now the retirement homes. This is a retirement home. As you know, we've already third vaccinated the long-term care home, so we will be vaccinating those as well, and that's the reason that that those are next on our plan to vaccinate. We've already done the long-term care homes. I showed that with you last week. Again, I shared it last week. What I want to go here is I want to just show you the positivity rates of Ontario. Today, we're at 1.7% on Ontario. And if you look at our rates, we're down to 4%. here. This is the East Ontario Health Unit area. And I just wanted to show this graphic here, which I think is an important one, which shows us the percent positivity by age. And you can see that, again, I showed this before, that around August, everything peaked and then started going down to levels which are more around the provincial average, which is around 2%, both for the 13 and 14-year-olds. And this is, I think, a reflection of going back to school. We can also see a slight decrease in the number of cases in schools, number of outbreaks. As a matter of fact, we only have 3. We closed about 6 or 7 of them yesterday and today. So we're sensing that this correlates into lower cases. So in September, almost 32% of our cases were in school age kids. Today, right now, it's about 16%. So we are sensing that it's going to go down. We are sensing it with a number of school cases. One of the interesting things that we're seeing as well is that by far the majority of cases in our schools, in regards to the school board, are not fully vaccinated. Again, very important message. This is another important graph that our EP team put together, which is looking at the types of exposures. And you could see the blue is household contacts. And you could see that this is a bit of an unknown exposure here, but by far in all of the school cases, the exposures were actually household or close contact. Some schools had a bit more, and this was the Upper Canada School Board, where we had a lot of cases in one of our first actual outbreaks at the Viscount School in Cornwall. And like I said, this was a special situation where we had exposure within the classroom and so on. But again, overall, you could see that the vast majority of the cases were not from school, were actually exposed, were exposed really outside of the school setting. This brings us to our vaccination rates. And again, I'm happy to report that overall, we're almost at 90% first dose and almost 85% second dose in terms of our population. And again, there are variabilities within that. We have some higher, much higher, some lower. Again, very happy to see that we're progressing with our adolescents here. We up to 81% right now. Literally about a month ago, we're barely at 70%, so we're doing well there. We've got some work to do, and you could see that for the most part, we've got, again, I want to repeat, we've got certain age groups that are quite high, almost 100% here, and in the high 90s. And so the lower age groups tend to bring down our numbers. But again, we are progressing, and we need to see everything, even out at around the 90% line here, which we're not far from at this point. Again, seeing a difference between women and men. Females tend to have a higher rate of vaccination as compared to men. This just gives you an idea of where we are with our first dose. We're delivering several hundred first doses per day on a regular basis, and you could see that last month we delivered almost 6,000 first doses, and so far we've delivered 1,500 first doses again, and that's really what's bringing our numbers up and inching us closer to that 90% mark. Second doses as well. You can see the trajectory here. We do anticipate that those 90% plus that have first dose will eventually get their second dose. So that's why I'm really looking at the first dose. But overall, when we talk about herd immunity, we're looking at fully vaccinated populations. This is just I showed this last week. Just looking at breakthrough cases. This is Canadian as well, just talking about the majority of cases being in non-vaccinated individuals. Going to the Cornwall situation is, again, it's a better picture this week than it was last week. However, we still got a bit of work to do. Again, you'll notice that the 34 here are the outbreak in Casselman at that retirement home. And as we move forward here, just to show you this trajectory, Cornwall is leveling off. Wanted to then bring your attention to our 7-day average of positivities here. And you could see that last week we were about 4.2%, which was, again, double the provincial average. Now we're 3.2%. So that's good in our area here, Eastern Champlain. And if we break it down by by area, postal code area. You could see again that we were, this is the Hawkesbury area here, where it was 5.1% this week. Last week was 8.3%. So there is a downward trend in all of these as well. This is the Cornwall area, the KJ, the FSAs, the postal codes that were among the highest in terms of cases. And so you could see that the numbers are stabilizing. As a matter of fact, one of the numbers last week was 9.8%, and that's gone down. So it has gone. So we're seeing it relatively going down. And you can see the yellow here. These are areas that have much lower percentage of positivity, and as you'll see, they are the ones with higher vaccination rates. So if you look at our vaccination rates again as of today, comparing first dose, we've actually brought it up to 78.3% in this area here, K6A, and we've actually brought it up to almost 77%. Again, this is last week's numbers here that are in bracket, and so we're bringing it up slowly. There are other pockets within Cornwall that are in the 80 to 85% range as well. But again, I'm happy to see that these are going up, and I think it's not a coincidence that we're starting to see a bit of a leveling off and decrease in the cases. Again, similar scenario within second doses. Again, our average is close to 85%, but then we're getting some headway. We're increasing 1.5% on a weekly basis in both the Hawkesbury area, but here importantly in the Cornwall area. You can see now that we've broken the 70% barrier here in second doses for the K6H and areas here. So again, happy to see that. Again, we still have some ways to go, but it is much better. Like I said, literally about a month and a half ago, we were barely at 50% in these areas here of second dose. So a lot of our efforts that are geared towards this population, I think, are bearing fruit at this point. I put this one together just to give you a context of the positivity, which is in black here. In bracket, it is what was last week, and in green I put the vaccination rates of the areas. So you could see that this is the Rockland area. We have high rates of vaccination here and low rates of positivity compared to Hawkesbury, where we have high rates of positivity and lower rates of vaccination. And you can see that the higher the vaccination, the lower the positivity, and you can see that across the board here as well. If you compare in terms of the lower vaccination rates and the higher positivities, again, positivities are going down, which is, I think, a good sign for us as well. This is, again, just a sort of comparison of vulnerable of some of our areas. And just to show you, like, again, we've got areas like, for example, in Clarence Rockland that are in the 90s, and Russell, like in the 90s. We've got areas that are, in the 80s and so on. So this is what we're concentrating on when we're looking at our demographic profiles. Overall, I think we've done quite well. We're now at almost, 90%. Again, it's disproportional because you could see that certain age groups and certain areas have gotten higher, so that's why we need to bump up the numbers. So we need a bit more than 224 to even it out, but we're getting close. And I remember about a month and a half ago, that number was like 16,000. So I think we've done quite well. Again, certain pockets of the population which are now improving, we need to continue with that improvement moving forward. So one of the things that I just wanted to talk about is, at this point we're going to do a third dose rollout. We are going to be giving a rollout to retirement homes, and like I said, in the retirement homes, particularly the one you see now, we have a lot of cases. The good thing is that in most situations, they're asymptomatic and not as sick as they were without a vaccination, but they do need a third vaccination. So we're rolling that out. We're going to be eventually rolling it out to individuals outside of congregate care settings. We're waiting for some recommendations. Our influenza vaccine is rolling out this week. We've got distribution to pharmacies and others. We now know we can co-administer, so when we go into some of the retirement homes and the elderly populations, they can get both vaccines at once. one on each arm, obviously. We are now preparing for the 5 to 11-year-old age group vaccinations, and they're the ones that are going to be approved likely within the next month and a half. Catching up on our school vaccination programs and so on, and stepwise lifting of restrictions. As you know now, we've got less restrictions, actually no restrictions for events, indoor events with the vaccine passports. There'll be progressive, removal of some of the restrictions as we go to that 90% second dose. So I do believe that we're headed in the right direction. The province is really stabilizing, but again, we need to continue and hold the line, not to jump the gun and start, going out with those, open up everything, very, very loosely without really doing it carefully and slowly. I think that's the trick, and that's going to maintain and protect our hospitals. Like I said, provincially, our numbers have been really flattened now, and so it's important to maintain that. Bonjour tout le monde, je vais commencer avec une présentation usuelle que je fais. On va commencer avec ici, on va commencer avec le bilan provincial. En effet, les chiffres provinciaux c'est très bon. On est rendu à 306 cas depuis hier. Hier, on était à 390. Donc, vous pouvez voir vraiment un plafonnement de la courbe. Encore toujours, on voit la plupart des cas, la plupart des hospitalisations chez les patients non vaccinés. Je vais démontrer, ça je l'ai démontré la semaine passée aussi, mais encore, je vais le refaire parce que ça vaut la peine. Ici, on voit le taux de COVID dans la population non vaccinée versus vaccinée ici. On voit vraiment 10 fois plus au niveau de risque d'être infecté, et le risque est beaucoup plus augmenté chez les enfants de 12 à 17 ans. La protection est beaucoup plus au niveau de la protection, et beaucoup plus, la différence est beaucoup plus chez les personnes 80 ans et plus. Donc ici, on a ajouté 54 cas, mais quand j'ai vu ça, j'ai été vraiment découragé, mais ça l'explique qu'on a eu en moins 34 cas, 35 cas dans une maison de retraite à Casselman. Et à ce moment-là, ça a augmenté le débit de cas que nous avons eu, mais en effet, on a ajouté 18 à Cornwall, mais aucun à SDNJ. Donc, ça nous augmente au niveau des cas, mais comme on voit ici, avec la vitesse avec laquelle on augmente, je pense qu'on va avoir moins de cas en mois d'octobre qu'on avait en mois de septembre. Ça, c'est une bonne signe pour nous. Si on voit ici au niveau de tous nos cas, on est rendu à 162 cas. Encore une augmentation importante depuis hier à cause qu'on a ajouté les 34 cas, 35 cas sur la maison de retraite à Casselman. J'oublie toujours le nom. Résidence Saint-François à Casselman. On a encore toujours les patients hospitalisés. La plupart sont encore non vaccinés. Et on voit ici, on a des flambées. La plupart des flambées sont autour de Cornwall. On a eu un décès la fin de semaine. Malheureusement, c'est une personne de 85 ans avec des problèmes médicaux non vaccinés. C'est triste. On voit ici le trajet qu'on voit, le moyen mobile. Vous voyez que Cornwall, c'est la ligne bleue ici, qu'on voit que ça va en diminuant. On voit un plafonnement, puis ça commence à diminuer. Donc, ça, c'est une bonne signe. En effet, on voit une petite augmentation ici à Prescott-Russell à cause des cas qu'on a ajoutés aujourd'hui dans la résidence. Mais toujours que j'aimerais souligner que ici, au niveau de 7 jours, le pourcentage de 7 jours, la plupart des cas qu'on a dès aujourd'hui sont des personnes non vaccinées. Donc ça, c'est une chose importante. Et j'aimerais juste vous comparer ici parce qu'actuellement, nous avons juste aujourd'hui, les cas que nous avons ajoutés aujourd'hui, 41% sont pas vaccinés, sont vaccinés, et à peu près 59% ne sont pas vaccinés. La raison pour laquelle on voit une augmentation, c'est parce que la plupart plupart des patientes qu'on a ajoutées aujourd'hui de maisons de retraite étaient vaccinées 2 fois. Et ceci est la raison pour laquelle on va donner les 3e doses aux maisons de retraite. On a commencé avec les maisons de longue durée et je vais vous parler tantôt au niveau de plan pour les 3e doses pour tous nos foyers des résidences de retraite. Ici, j'aimerais vous démontrer la positivité au niveau des tests. En Ontario, on est rendu à 1,7 %. Et si on compare ça avec le bureau de santé, on est rendu à 4 %. Donc, on est plus que double le pourcentage de positivité d'Ontario. Et si on voit au niveau de la positivité chez les enfants, surtout les enfants, vous voyez, en mois d'août, on avait une augmentation des pourcentages dans tous les âges, mais on va voir ici le mot, ces 2 lignes ici. Vous voyez que ça en avait un maximum à peu près en 3e, 4e semaine d'août, et à rentrée d'école, ça commençait à diminuer, donc on est rendu à 1,2 1,8 % pour les enfants de 13 ans et 14 à 17 ans. Donc, on voit que, à mon avis, l'école, à cause qu'on a des protections en place, etc., les masques, la surveillance, on voit que ça va diminuer. Et nous voyons aussi le pourcentage des enfants, dans tous nos cas, c'est moins que c'était au mois de septembre. Donc, autrement dit, les enfants étaient déjà en contact, étaient déjà positifs en rentrant aux écoles. En parlant des écoles, ici, on voit tous les cas qu'on a dans les écoles par commission scolaire et on peut voir que la plupart des cas ne sont pas vaccinés. Bleu, c'est vacciné, orange, c'est pas vacciné. On voit la même chose au niveau de l'exposition ou le contact, où est-ce que les personnes ont attrapé le COVID. Et la plupart des cas, c'est à la maison ou en dehors de l'école avec un contact proche dans ces personnes. Ici, l'école Viscount, par exemple, à Cornwall, Viscount, on a eu beaucoup des enfants qui étaient en contact. Ça, c'était un cas spécial. C'était les jeunes enfants qui ne portaient pas les masques à ce moment-là. Donc, on voit un petit peu plus, mais quand même, la plupart des expositions qu'on voit dans les écoles sont pas, l'origine n'est pas à l'école, l'origine est à la maison ou à l'extérieur de l'école. En parlant des vaccins, on est rendu maintenant à presque 90 % en général de la population avec une première dose et presque à 85 % avec une deuxième dose. Donc, ça, c'est un bon trajet. C'est un peu plus que la moyenne ontarienne, malgré que nous avons des régions qui sont à plus que 95 % et des autres qui sont à 70 %. Je vais vous en parler tantôt. Encore, on voit que les jeunes sont moins vaccinés, mais on voit une progression, surtout chez les adolescents. On voit toujours une différence entre les femmes et les hommes. Encore, les femmes sont plus le taux de vaccination est plus élevé que chez les hommes, surtout aux jeunes âges. Nous avons ajouté en mois de septembre presque 6 000 premières doses et 1,5 000 déjà en octobre. Donc, ça va bien, notre trajet va bien parce que nous, on veut dépasser le 90 % et étant donné qu'on va avoir la première dose à 90 %, à un moment donné, ces personnes vont avoir la deuxième dose qui va nous rendre à 90 % deuxième dose à un moment donné, dans quelques semaines. Donc, on voit la même chose avec le trajet au niveau des vaccins pour les deuxièmes doses. J'ai démontré ça la semaine passée. C'est juste plutôt pour voir, pour démontrer en Ontario, la plupart des cas, hospitalisations et décès sont chez les personnes âgées. C'est la même chose qu'on voit canadienne ici. Encore, les cas, les hospitalisations, les décès, on les voit surtout dans les personnes non vaccinées ou partiellement vaccinées. Au niveau de Cornwall, on voit que ça diminue les cas. Je pense que la semaine passée, on était à 100 cas actifs. Vous voyez à Casselman qu'on a ici, ça c'est la maison de retraite. Donc, on voit le Cornwall, c'est en diminuant. Donc, on voit que c'est un plafonnement au niveau des cas dans Cornwall. Aussi, au niveau de la positivité, je vous ai mentionné tantôt que c'était un peu moins que 2 % pour Ontario. Pour notre région ici, c'était à 3,2 % de la positivité. La semaine passée, c'était 4,2 %. Donc, on voit que ça diminue, ça c'est une bonne signe. Ici, on voit le taux de positivité dans toutes les régions. Notez que ici à Cornwall, qu'on a des problèmes, on commence à avoir une diminution de positivité qui était une bonne chose. La semaine passée, c'était à 7,8 %. Vendredi, c'était à 9,7 %. Donc, on voit que ça a diminué. Et on voit la même chose ici à Hawkesbury, qui était à 8,3 % la semaine passée. Là, on est rendu à 5,1 %. Et on voit aussi que c'est bas dans les autres régions aussi. Je vais vous donner, vous allez voir un autre diapo qui va plus démontrer ça. Au niveau des premières doses aux zones spéciales, aux régions défavorisées, on voit qu'on commence à augmenter. La première dose, on est rendu à 78 % autour de Hawkesbury. On est rendu maintenant à presque 77 % au niveau de Cornwall, 4-6H, et on augmente à 4-6J. Le chiffre ici en parenthèse, c'est le chiffre qu'on avait la semaine passée. Donc, on voit une progression importante. Même chose pour la deuxième dose. Rendu ici, on voit qu'on commence à augmenter. Là, on est rendu à 70 % autour de Cornwall ici et à 77 % dans une autre petite région de Cornwall. La même chose on augmente doucement le chiffre à Hawkesbury aussi. Ici, ce diapo vous démontre vraiment qu'est-ce qu'on voit. J'ai mis ensemble le taux de positivité et le pourcentage de vaccination en vert ici, première dose, deuxième dose. Donc, vous pouvez voir ici à Hawkesbury, par exemple, la positivité est à 5,1 %, c'était 8,3 % la semaine passée, et le pourcentage des personnes vaccinées, c'est 78 %. Première dose, c'est 73 % deuxième dose, mais vous allez comparer ça dans d'autres régions de Prescott-Russell, à Rockland, où on a un pourcentage de vaccination beaucoup plus élevé. Dans première et deuxième dose, on voit un pourcentage de positivité très bas. La même chose pour Russell, on voit un taux de vaccination très élevé avec un taux de positivité très bas et on n'a presque aucun cas dans cette région. Par contre, on voit que le taux de pourcentage de positivité est élevé avec un taux en bas de la moyenne de l'Est d'Ontario au niveau de vaccination autour de Cornwall ici. Donc, on voit que ça augmente, par exemple. Ça augmente au niveau... les deux chiffres vont à la bonne direction. La positivité chez les régions, soit Cornwall et surtout Cornwall dans les régions défavorisées, on voit que le chiffre de positivité commence à diminuer avec l'augmentation de débit de vaccination. Donc, ça, c'est le bon signe. Donc, et ça, je pense, à mon avis, ça se traduit par le fait que nous avons maintenant moins des cas, le moyen mobile à Cornwall commence à diminuer. Donc, c'est pour ça qu'on le voit. Donc, ce n'est pas une coïncidence que Cornwall était une hot zone et ça commence maintenant à être moins des doses. On a encore des doses, mais le débit est moins et j'envisage que si on continue comme ça avec une augmentation de débit de vaccination, qu'on va avoir une amélioration. Bien sûr, ici, vous allez voir la différence, comme Russell, ici, South Glengarry, mais vous voyez ici, comme par exemple Cornwall, Champlain, qui est autour de Hawkesbury, c'est un peu plus bas. Donc, vous voyez la différence. C'est pour ça qu'on a aussi élevé que 96 % et aussi bas que 76 % pour la première dose. Et aussi, on a des régions avec 93 % versus 70 % de la première dose. Donc, c'est pour ça qu'à la moyenne, on est bien. Parce que les chiffres commencent quand on voit les moyennes, mais on voit qu'il y a des régions dans notre bureau de santé, dans la zone de jurisdiction, qu'on a besoin d'augmenter le débit. Mais quand même, c'est une bonne progression depuis 4 à 6 semaines, surtout Cornwall et Champlain autour de Hawkesbury. Nous avons besoin, en général, j'ai calculé qu'on a besoin de 164 700 doses pour atteindre le 90 %, à peine 200 doses. Je pense qu'on a besoin un peu plus que ça, mais c'est une bonne chose, c'est un bon niveau qu'on va réussir, à mon avis. Ça, c'est très, très bonne nouvelle. C'est sûr que certaines qu'on va avoir besoin de billes beaucoup plus dans les régions qui sont un peu plus bas et dans les âges, dans les démographiques d'âge qui sont moins vaccinés, mais on va le faire. Je pense que 90%, ça va nous rendre très bien et on va bâtir sur ça. Juste pour dire, au niveau de la troisième dose, on va sûrement donner les troisièmes doses, comme j'ai expliqué, parce que le taux de protection chez les personnes âgées diminue. Donc, déjà, nous avons tout vacciné, les maisons de longue durée, et là, on a eu le directif cette semaine de commencer à vacciner les maisons de retraite. Vous voyez, on a eu des cas, 36 cas, 34 cas dans une maison de retraite à Casselman. Donc, on va aller les vacciner le plus vite possible pour qu'on donne la troisième dose pour les protéger parce qu'on sait qu'au bout de 5, 6 mois, le taux de protection diminue. Chez les personnes en bonne santé, en bas de 65 ans, la protection va durer 8, 9, 10 mois, mais chez cette population et la population qui ont des problèmes immunodéficience, on va donner les troisièmes doses. En général, pour le moment, pour la population générale, on n'a pas besoin de donner une troisième dose, mais c'est une chose à suivre dans les prochains mois. On commence avec l'influenza, le vaccin antigrippal, sûr et certain qu'on va protéger tout le monde contre ça aussi. La bonne nouvelle, c'est qu'on peut co-administrer les deux. Donc, quand on va commencer à donner une troisième dose chez les personnes âgées, dans la maison de retraite, etc., on pourrait donner l'influenza en même temps. Donc, bien sûr, on se prépare pour les enfants. On prévoit qu'il va y avoir une approbation qu'on pourrait utiliser le vaccin COVID chez les enfants Pfizer de 5 à 11 ans d'ici 4 à 6 semaines. Donc, on se prépare pour le faire cette année et on est en train de travailler avec nos écoles pour voir comment on peut rattraper les vaccins non COVID. Et aussi, j'aimerais juste souligner aussi qu'on continue on est dans l'étape 3 et vous voyez progressivement, on commence à enlever les restrictions. Vous avez attendu sûrement qu'on pourrait avoir l'aréna plein pour hockey. Mais ça prend le vaccin vaccinal et ça prend les masques aussi à l'intérieur. Donc, bien sûr, toutes ces précautions doivent être prises. Qu'est-ce que je prévois aussi, c'est que ça va rester comme ça. Ça va rester comme ça jusqu'à temps qu'on atteigne 90% de deuxième dose à travers de toute la population. Et on va voir progressivement que ça va diminuer au niveau des restrictions. Et ça, j'aimerais ça que ça soit de faire d'une façon lente, prudente, mais qu'on ne va pas reculer. Donc, je pense que ça, c'est une bonne chose. On est sur le bon trajet. Nous, on a eu comme un peu des problèmes dans notre région. On voit que ça commence à diminuer. On va continuer avec nos activités pour promouvoir le vaccin, surtout dans les régions défavorisées, etc. Mais on voit en général, on est en bonne condition, sauf, comme j'ai dit, à Cornwall, nos hôpitaux l'hôpital de Cornwall est débordé. Par contre, en restant d'Ontario, la moyenne, les hospitalisations sont très bas. Donc, c'est une chose à suivre, mais je pense qu'on va dans le bon trajet. Nous, on est un peu en retard, si vous voulez, en comparaison de le restant d'Ontario, mais on va l'attraper. Et je pense que d'ici quelques mois, on va voir on va retourner plus à la normalité. Pas tout normal, mais je pense qu'on va avoir, on va être capable d'enlever quelques restrictions et peut-être changer un peu les vaccins de passeport. Peut-être il y aurait des places où on n'aura pas besoin. Mais c'est une chose à suivre. Mais je pense que l'idéal maintenant, c'est juste de continuer à se faire vacciner si vous n'êtes pas vacciné, parce que le plus qu'on atteint le 90% et plus dans toute la région, le plus qu'on va être capable d'avoir moins de restrictions. So I'm just going to look at the questions here that I've got. There was a question here by the Ottawa Citizen, Ottawa Sun, about a comment that I made last week saying I supported mandatory vaccinations of education staff and recommended that all full schools adopt that, and only 2 French language boards had done so. I just want to clarify that. I have recommended, yes, we're supportive of mandating it for educational workers, but what you're mixing this up with is I've also strongly recommended masking for JK and K. And at that time, 2 out of the 4 school boards had done it. My understanding is that the other 2 school boards are seriously considering it. So that's what I'm talking about. So the school boards are looking at mandating it. They're waiting for a provincial direction as well. So I just wanted to clarify that. Look at yes, any plans for trick-or-treating? Yes, glad you asked that question, and I will actually answer it in French as well. The Halloween and other events this year will be able to go on. Obviously, there will be Remembrance Day as well, but for Halloween, yes, we will be not recommending, no Halloween, but again, recognizing the children, are not vaccinated. So we will have on our website either today or tomorrow some guidelines for that. Safe trick-or-treating, safe gatherings, and so on. Moving forward, trick-or-treating outside, if people are careful, outside is much safer in terms of the transmission. There's the transmission rate is 1/20th of indoors. So if you take the proper precautions, and again, we will have a whole list of things to do to prepare if you're trick-or-treating, if you're receiving, and that'll be on our website for sure. There's also going to be Remembrance Day guidance, and we're now working with the ministry to put guidance documents out for Christmas festivities, Santa Claus parades, and so on. And so those will come as well as we move forward. A question here that I haven't. I'm going to look at the other answers. Is there a vaccine mandate for the EOHU employees? Yes, we're 98.5% vaccinated, and we do have a mandate. What has been said about Cornwall, the postal codes? What have we done? We have basically we have brought the numbers from low 50s to 70s right now. So we're seeing a steady increase. We have worked with social service agencies, of pop-up clinics, opening up our clinics to walk-ins in the mall. We have done clinics in Agape. We've done clinics in factories, in manufacturing plants, anywhere we can to be able to increase our reach for this population. It is working. It is long, but it is worthwhile because we are seeing now an increased uptake with that first dose, and obviously we're going to deliver the second dose. And we're also now starting to see a decrease in positivity, which is another important thing, and a concomitant decrease in the rates of the cases that we're seeing now in the Cornwall area and surrounding areas. And that's it, Jenna.
Thank you, Dr. Paul. Merci. Notre première question nous vient de Émilie Bergeron, ici, Ottawa-Gatineau. C'est à vous?
Oui, bonjour, Dr. Paul. Je voulais vous entendre. On a appris hier que la frontière américaine va réouvrir en novembre pour les Canadiens qui sont vaccinés. Qu'est-ce que ça peut vouloir dire pour votre région sanitaire? À quoi vous vous attendez?
Je ne pense pas que ça va faire une grande différence. Déjà, nous avons un va-et-vient avec Akwesasne. Je ne pense pas que ça ne va rien changer parce que les personnes qui vont être admises aux États vont être vaccinées. Donc, je ne pense pas que ça va nous affecter de façon importante.
OK, donc vous n'avez pas d'inquiétude. OK, merci.
Pas de problème.
Next question, Nicole Williams, CBC Ottawa. Please go ahead.
Hi, Dr. Paul. Thanks for taking my questions. My first one is I just want to confirm of the 19 people of the 19 COVID-19 patients in the Cornwall Hospital right now, how many of them are unvaccinated?
Right now we've had Sorry about that. I just count because I have different counts.
That's okay. Take your time.
Out of the 19, right now we have 11 that are not vaccinated. The remainder are from retirement homes and elderly individuals that are vaccinated.
Okay. And I guess I'm wondering if you could just speak a little bit more about the situation at the Cornwall Hospital, the fact that they, had to elect to shut down some surgery rooms because of the surge in COVID-19 patients. Could you just speak to that, please?
Yes, I've been in contact with the CEO of the hospital on a regular basis. We're aware that they've had a disproportionate number of COVID patients. They've also had an outbreak on one of their floors as well, and so that requires more of their personnel, and they've had to shift a lot of the personnel. And as you know, there's the health human resource shortage across Ontario, and so as a result of that, they had to reduce some of the surgeries to be able to redeploy staff to take care of the COVID patients, and some of which were in the ICU as well. So, and that's the reason that we sent out the press release, the joint press release on Friday, just to ensure, because a lot of the patients that they're having are indeed from the Cornwall area, and most of them were unvaccinated. And so that's why we wanted to ensure that people understood the repercussions that not only, if a person is unvaccinated, not only will that individual, have higher rates of complications, including hospitalization and ICU admission, but it'll also overwhelm our healthcare services. And that's really the basis of what we're trying to do. If we had a lot of cases, but everybody was well and didn't require hospitalizations or medical treatment, we'd live with it. But we're trying to not to overwhelm our hospitals. And contrary to what we're seeing across the province, Cornwall is an outlier, unfortunately, in being overburdened with these cases. So I'm heartened by the fact that we're starting to see a positivity. We're starting to see a decrease in the numbers. So I'm hoping that with time, those numbers will go down and they'll be able to recommence their activities that they've paused for the moment.
Thank you, Dr. Paul. Next question, Thomas Stockton, TPC 22. Please go ahead.
Hi, Thomas. Good, yourself? Yeah. Yeah, well, I can tell you that the majority of cases, we think it was a symptomatic staff. We're not sure where the source was, but we do know there are some staff, and there's a lot of residents as well in that home that are positive. I can tell you that the majority of the 38 positive cases that we had there among residents, and again, it's a tentative number because we have to make sure that they didn't double. We'll make sure that there's no duplicates, but let's put it that way. The majority of those, we have 4 on hospital right now, but they're not very sick, not in the ICU, but the majority are either asymptomatic or very minimally sick, which is what the vaccine should be doing. If it does not prevent the disease in the first place, it should actually, in those individuals who have the breakthrough, and these are individuals that are the category that breaks through because of the age group, these individuals, will have minimal or no symptoms and not require hospitalizations or anything, or treatment or anything like that. So, but it also tells us that, we need to start vaccinating the retirement homes. We started with the long-term care homes, but now we need to vaccinate them to give them the 3rd dose, because now this is the time where we're starting to see it wane down, because we vaccinated these individuals around February, March, I think it was. So now is the 6 months where we're starting to see it wane. So for the most, thankfully, most of these individuals are asymptomatic and not not very sick. But it also really is proof in the pudding, for lack of a better word, that we need to they need third doses. No, well, I don't think I presented the statistics of I don't have the statistics of the boards. I think I presented something else, but I can tell you that in that particular situation, I know what happened. This was in a JKK situation where the children were not masked. And so it was, and they were obviously not vaccinated. So that was an exceptional situation where we had a lot of intra-school transmission, but that was exceptional to that situation. And that's one of the reasons that I have recommended masking for JK and K. No problem. No problem.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux.
Hi, can I go?
Yes, please go ahead.
Hi, sorry. So I know that La Nation and Hawkesbury have instituted mandatory vaccination policies for healthcare and municipal employees. I was wondering if the EOHU was going to be instituting a region-wide vaccine mandate, and if not, are other municipalities looking to institute their own vaccine mandates with the help of the EOHU? And follow-up question, I haven't seen anything about what will happen to people who refuse to get vaccinated under these new mandates. Do you have any information on that?
Okay, yeah. Well, first of all, I do know that the long-term care has been mandated provincially. And there are some discussions about a provincial mandate for healthcare settings. We have strongly recommended having a vaccine policy in place to all businesses and municipalities. And depending on the risk of what you have, you can go. It could be anywhere from test to not vaccinate, or work at home, or disciplinary action where you can go leave without pay, and so on. And those, we have not gone that far. We do not feel that an across the board recommendation would be appropriate. What we've done is we've got guidelines on our website right now that actually give them a template of how to do a risk assessment, what the pros, what the options are, testing or not, and so on. And so that's what we're doing. But I do know that, like I said, long-term care is mandated provincially, and a lot of the hospital settings and healthcare settings have mandated it themselves, including our health unit as well, for our employees. What was your second question? I forgot the second question.
Yes. So is there any new information on what will happen to people who refuse to get their vaccinations under the mandates in La Nation, Hawkesbury, and in other places that may have?
I don't know what they've done. I know it varies with the employer. Some employers may suspend without pay. Others may say work at home. It depends on the employer. That's not something that we have imposed on.
Oh, okay. Okay. So it depends on, okay, perfect. All right, thank you so much.
No problem.
Those are all the questions for today, Dr. Paul.
Thank you. Merci tout le monde.